Miss Stephanie
Hi.
Williams, one of the amazing human beings here at Art of Skin MD and our PA. And so we thought we would just give a quick talk about exosomes. I think it's very topical, to really use a bad pun, I should say. So we want to talk about that technology a little bit and how we combine it. Either an at-home treatment, which there's 4 different products from Invo Aesthetics we're going to discuss. And then the common procedures we tend to use it with, which includes the Exion platform, which I have right next to me. So maybe, Steph, you can hand this. So this is actually, I would say, one of our sort of best sort of utilized and repurchased products that we have now here in our practice. We've had Invo Aesthetics in our practice, gosh, about half a year now. And this is a cultured medium. It comes from 3 sources. So human fibroblasts, those are the cells that produce things like collagen and elastin in our skin. It also comes from Wharton's jelly, which is from umbilical stump, and then donated bone marrow. And from these, we create this amazing soup of different sort of topical active agents. One is peptides, which are small proteins that have biological effects on the skin. They either upregulate or downregulate things from a cellular perspective. Growth factors, which are big proteins that don't generally sort of penetrate the skin. But if we create portals of entry, that's possible, but they still have a biological effect. Even if they're sitting on the top surface of the skin, they can create cell-to-cell signaling that help with anti-inflammation and collagen growth. And then finally, it's got exosomes, which is kind of the hero ingredient in the bio blend of this Invo Aesthetics product. And exosomes are like little packets that get pinched off of our cells, and they tend to really communicate to the surrounding environment messages that are very anti-inflammatory and pro-regenerative. And so we see sort of cosmetic improvements in the skin, and we also use this to help support hair growth. So maybe, Stephanie, if you want to talk about, we've got 3 different topicals that we use here in the office. So if you end up purchasing the Invo Aesthetic topical product, which I use this at nighttime, it can be used twice a day. Very well tolerated. We just see in general sort of cosmetic improvements in the skin. It tends to help with textural improvements. We sometimes see reduction in pinkness of the skin as a result of continued use. It sometimes globally just helps the appearance of the skin, so a little unevenness and pigmentation is improved, and just radiance and youthfulness of the skin, I think, has helped. So what do you like to pair it with usually at home?
Yeah, so at home I usually use this as like an anti-aging serum, and I'll use it with my brightening pads, vitamin C. I use a retinoid at night, but I think it's been great for all my patients with melasma, patients who are acne prone, because it's anti-inflammatory, also helps with healing. So post-procedure, post-lasers, microneedling, it's done a really awesome job of helping patients heal in faster and just getting the best out of their treatments.
So that's great. So here in the US, I'm a clinical investigator on trials, and Stephanie often participates as a blinded investigator in some of our phase 3 clinical trials. We're very careful to follow the rules. So you sometimes will see on social media just outrageous things being done. Things like, salmon skin being injected, things like exosomes being injected, and that's technically not FDA approved. So when you see influencers and you see clinics posting that, they're actually not following the guidelines that are outlined by the US FDA. So what is actually approved for exosomes here in the US, it is FDA approved for cosmetic use, for topical use, so that's the product that we just described for at-home use, or we can do it in combination, topically layered with something like microneedling. So that's how we tend to use it here in this office, because we like to follow the guidelines. And so maybe you can talk about the 3 products that are in the white boxes.
Sure. So with Invo, they actually have these used for clinic, the same ingredients that are in that take-home product that Dr. Palm mentioned, but it's just more concentrated, and they come in these tiny little vials that we're able to use after microneedling, so either with a skin pen or with the microneedling with radio frequency, and it's just a 1 milliliter
I can open it
tessage. Thank you. And we just literally apply it right after microneedling, if we're doing a skin pen, I can actually use it as a glide. So as I'm gliding through the tissues, as I'm treating, I'm using this product on top, so it's getting penetrated into the second layer of our skin through those little channels that we're creating with either the needles, through a skin pen, or with the microneedling device with the radio frequency right here with the Exion platform. So yeah, thank you. So this is what they look like. They're those tiny little tesselages, and one of these are enough to just treat the face and neck. And I've been doing a lot on arms, and so it spreads very easily. So they have the basic formulation, which is the rejuvenating complex, and then they also have one for brightening. So patients who struggle with melasma or unwanted pigmentation or even rosacea, this is great because in addition to the ingredients that are in the rejuvenating complex, it also has topical tranexamic acid, for example, vitamin C, niacinamide. They all play a role in reducing inflammation and helping even out the complexion of your skin. So this is a great option for those of you who struggle with unwanted pigmentation. And then finally, there's a hair restoration serum that we're using a lot of for male and females who are struggling with hair loss, or just male or female pattern hair loss, that we do in conjunction with microneedling, and it really helps with stimulating the hair follicles to help with hair regrowth and increasing the blood flow to that area with the microneedling. So we've been having great success with all three of these products. So yes, we love it.
And you know, we, as I mentioned, we really enjoy research, and so currently we're doing some studies looking at radiofrequency and microneedling with hair loss, and this is currently in FDA cleared indication in terms of what we can use the Exion platform for. It doesn't require any topical anesthesia, so this radiofrequency and microneedling is very easy to tolerate, which I think, you know, some procedures we've done in the past, it can be a little bit uncomfortable in terms of trying to provide sort of density of hair growth. And so I think there's new avenues we have. We currently have a hair serum that we use for topical hair loss, and supporting that with some of the oral medications, and just looking, you know, biologically, seeing if anything is out of place from a systemic standpoint in terms of hair loss. But stay tuned. I think we may have opportunities for exosome technology topically in that front. So I think there's a lot of sort of frontier. I think here at Art of Skin MT, we try and look at technologies that are regenerative and supporting a lot of our biological processes. So that's why we enjoy doing things that support healthy collagen growth, help support the skin, help support healthy hair growth, and they tend to be very well tolerated by patients. The formulator for this particular product has formulated some of the blockbuster hits of other skincare lines for at least a couple of decades. So I think it's a great line. I think Exosomes you want to use appropriately, and there's a couple of lines beyond Invo that I think are good players within the market, but we chose Invo Aesthetics to carry here in our office to represent sort of the exosome market. So if you have questions about how to use this either in office or topical use at home, certainly let us know. Stephanie and I can help educate you on the products and sort of best use practices and how to use them safely here in the US. But just wanted to give you a little bit of a primer of what we're doing. You know, we tend to combine these topical products with procedures where we're creating avenues for entry. So either microneedling, and there was a study in 2024 that came out that showed that you really need to get to about 1.5 to 2 millimeters for some of these topicals to penetrate appropriately. So, you know, our standard skin pen does that. When we're using it for microneedling, I think we're really taking advantage of topical absorption because we're usually not using those depths and things for hair regeneration. But all the same, I think people heal a little bit faster, and we're also applying a topical regimen that may help support just healthy tissues. So with that, we're going to say goodbye, but just wanted to do a brief lunch and learn, and hope you guys learned a little something. Exosome is the word of the day. And if you've got questions about it, ask Stephanie and I, and we'll see you next time at Art of Skin MD. Thank you guys.
Bye, thank you.